So same the other side, we can raise the bedside. And this is very important safety issues. In case your patient have the resuscitation needed and ambulance bags available here. So Lisa, if I like to have patient rise to the bed of the head, which button we should push?
So you can either be on this side, so the patient could put their head up, or if
Wonderful.
you're on this side, there's also a button right by the red nurse.
How's about this bed is too low, not the appropriate height for me? Can I rise the whole bed up?
Yes, you can. So open this, it'll say bed high, and it will raise up.
Good, thank you.
Always remember to put your bed down when you're done.
Okay, and the patient have the bedside table. We would like you using for putting your medication, your equipment here, not top the patient.
Correct.
So let's go on the detail for our car. So Lisa, can you show them your medication?
So to start, the top drawer is oral meds. Any oral medication you may need is all in here. There are slots which say which each one is. Here's liquid, and here you would have a syringe to draw that up if needed.
For RN student, we may not use the oral medication, but very important you have an IV therapy. So we have two drawers for the IV med. The top one usually is a critical medication. If you have patient need coded, then all the medication here. We would like to emphasize in this drawer is we put your antibody IV piggyback will be on your left side. This is very important for you to know about that. And we also try to put a label. Remember, each drawer have their brand name and the generic name. If you could not find it, you make sure you look at the drawer book and then find the other name. And the second one, the IV drawer, it will the RN student, you will use it. We try to put the name, follow the alphabet. You can see the A's here, and then you will have a C. Very important also, we put the two medication on the side here, did not have a label yet. The one will be your glucagon. For PN student, you also will use it as well. And also insulin, the pen. And then also your insulin, you can either, sorry, not this one. For this one, you can use it for the sub-Q. For RN student, you oftentimes may use it for the regular insulin for the IV infusions.
The drawer following just says airway equipment. Anything you should need for a respiratory problem is going to be found in here. Whether you need a mask, you need a nasal cannula, nebulizers, everything you will find is in here.
The last one, the Ventura, so all the way back.
The Venturi mask.
All right, next one is very easy. We kind of call the dressing changing drawer, and also for the AccuCheck, the monitors on the side, and also the tape.
So this is your needles, syringes drawer. Anything that you should need for a sharps or a syringe, you will find in here. Here is for your insulin pens, and then flushes for an IV should you need.
The very end over there's a larger size syringes. Sometimes you may use it for your NG tube and for the irrigations. The student, RN student, you want to make sure this drawer we have a TB syringe and also insulin syringe, so you need to make sure which ones you need. And for the we have pre-refilled saline flush, and this is available for in this drawer as well.
Your last drawer is miscellaneous. There's sterile gloves, you have your IV starting kits, your bags of fluids, there are chucks, and a Foley tray.
Depends on the case. Each simulation we may add more equipment. So if you're not able to find the drawer, usually we will put the table on the outside for you as well. I think we wish you have a good simulation experience. Thank you very much.
Thank you.